Donald Trump saying Americans hate Obamacare. Actually, not so much. But now we know, at least probably know, the outlines of Trump and the Republicans' proposal to deal with the so-called crisis in Obamacare. I say so-called crisis because it was created by Marco Rubio. If you just plug in to a search engine Marco Rubio and risk corridors and the word Obamacare, the New York Times article that lays all this out will pop right up. And it's from a year ago. And about a year ago, what Marco Rubio did, well, let me back up a little bit. When they put together Obamacare, there was concern that if we say to the insurance companies, you have to insure people even if they're sick, because the insurance companies have been saying to sick people, once you get sick, they drop your coverage, called rescission. And if you're already sick, they won't sell you coverage. So when you say to those insurance companies, sorry, you're going to have to pay for these sick people, they're going to lose money, at least for the first 5 years or so, until kind of all the sick people are in the system and everybody else is in the system, and it all kind of washes out. So for the first, I think it was the first decade, it might have been the first 10 years of Obamacare, there was this thing called risk corridors. And what they did was basically said, if you, insurance company, if you, Aetna, United Healthcare, whatever it may be, if you lose money in any particular year on Obamacare, operating under the rules that we've defined, we'll make up your loss. So it was a subsidy to the big insurance companies. It was a subsidy. It was largely paid for with a tax on people who make over $400,000 a year. A small tax, but, on lots of money. So Marco Rubio inserted into the budget bill last year, the omnibus budget bill, this little rider that blew up the risk corridors. Well, once those risk corridors are gone, health insurance companies immediately started losing money. And as soon as they started losing money, they started raising their rates so that they could make money because they had to make back that government subsidy. That law took effect. The U.S. budget takes effect October 1st every year. We operate in a fiscal year, October 1st to September 31st. So on October 1st of last year, 1 month and 1 week before the election, and the insurance companies saw this coming, they lost their government subsidies and they started raising their rates. And of course, the Republicans went into the election going, look at that, Aetna just raised their rates 35% in state so-and-so. Yeah, Red Cross, Blue Cross Blue Shield just raised their rates 10%, and so, et cetera, et cetera. And Rubio set this thing up, with the help of a bunch of other Republicans, of course, but it was principally Marco Rubio's efforts. As I said, Google it. Just plug in Marco Rubio risk corridors and Obamacare. It pops right up. This was intentional. This was put into place a year in advance to blow up. This was an October surprise, to blow up October 1st, 2016, just before the elections. And it did, and it worked. So now without the risk corridors, you've got health insurance companies that are saying, we can't afford this. You've got some states that are only going to have one insurance company. This really and truly is Obamacare in a crisis, caused by Republicans, mostly Marco Rubio. So what do we know about this repeal and replacement of ACA that Donald Trump is talking about? Well, for the people who are really rich, here's what they're going to get. They're going to get a major tax cut of $346 billion over the next decade, because those risk corridors and other parts of Obamacare were being funded by actually raising taxes on rich people. So the very well off, they're going to see a $346 billion tax cut. If they have a health savings account, or even if they're uninsured, no longer have to pay a penalty, and they get a bigger tax shelter for their health savings account. They're going to get a brand new subsidy to buy insurance. Everybody, including Bill Gates and the Koch brothers, everybody's going to get money from the federal government. 50% of all the tax cut benefits from repealing Obamacare are going to go to just exclusively to millionaires, people who earn over $1 million a year. And there will be a $10 billion cut to pay for pharmaceuticals, to pay for alternative health plans, to pay for medical devices and things like that. Now, if you're in the middle class, that's what rich people get. If you're in the middle class, this is what you get. Your subsidy to buy insurance will decline from the average of 57% from $6,300, which is the average subsidy that you're getting right now, to $2,700. So you're going to lose about $4,000 a year that you can use to buy insurance with. The subsidies will no longer be tied to income, geography, or as premiums rise. So, if you live in a high, like in Alaska, health insurance costs about twice what it does on the continental United States. Tough luck. Major premium increases will happen to people between 55 and 64 years old, because that will allow them to reduce premium rates on younger, healthier people. The tax increase on employee benefits that you get right now, the benefits are likely to be reduced, and millions are going to lose coverage. That's for the middle class. For the working class and seniors in nursing homes, the Medicaid expansion is going to be reduced by $277 billion. This is about a 40% cut, which means most states are going to drop Medicaid, or at least the Medicaid expansion. There'll be a $370 billion cut to the core of Medicare over 10 years to pay for that tax cut for billionaires, which means that really poor people are going to get screwed. And Medicaid will be block granted and capped forever, which means that every year, as expenses go up, the amount of money in Medicaid goes down, millions are going to lose coverage, and the coverage you have is going to be less and less consequential and useful. And for everyone, this is, by the way, from AmericanProgress.org, and for everyone, sicker people can be charged more if they have a gap in coverage. 10 essential benefit protections will disappear, including mental health. And the Prevention and Public Health Fund, which is 12% of the CDC's budget, this is going to be eliminated. So get ready to see, like serious diseases tracking, up. Not going to be a good thing.